Today we're going to be talking about estradiol, the ranges of which you should stay within, especially when enhanced, and what are your options when it does become too high. People who are on enhancements, an average dose for your E2 levels is going to be between 10 and 20 picograms. A too low range is going to be 10 or less picograms, and anything north of 30 is going to be a little bit on the higher end of things. Now, what does that mean for you if your estradiol is higher, especially if it's in 30 and the normal range, they say below 50. So what that means, because we're taking testosterone, that could aromatize into estrogen, which then can cause the problematics of gynecomastia, water retention, fat gain. These are all things that we don't want. This is the opposite of bodybuilding at that point. Or this is the opposite of what we want our PEDs to do for us. So what options do we have? You can use Arimidex, you can use Femara, you can use Aromasin. Now, the reason why people might not use these is because they are harsher on their lipid panels. Now, Aromasin is less harsh than Arimidex and Femara, so that is personally my favorite one that I use. Not saying which one is best, but that's just what I like. So for the dosing and durations, that's gonna depend on the compound you use. So I'm gonna use Aromasin, for example. When I went and got my labs tested and my estradiol was 145, 145, it was absolutely high. I was taking 25 milligrams every other day for 3 weeks. Then we cut it down to 12.5 milligrams every other day for another 3 weeks. And then after that, when we threw in Primo in, I was only taking 12.5 milligrams twice a week, which is where I'm currently at now. Now, you can use anabolics to lower your E2 levels. This is a way that most people are going to take this approach because they're like, they get the benefits of the anabolic and they get the estrogen suppression. Most common ones, Masteron, which it doesn't aromatize at all, and it is a weak receptor antagonist. Primo, non-aromatizing with more mild effects. Or you can use EQ. This one does aromatize a little bit, so it gives like more stable estrogen levels. Now, there are some things you can do on the natural side of things to take care of this as well. You can use something like DIM, I3C, Chrysin, Resveratrol, and then using like hormone stabilizers. I used one called Estracorp. Other than that, guys, I'll see you in the next one.